Good morning, everyone. Thank you for joining me in practice management and practice operations for LinkedIn Live today. I'm excited to have my two guests. I have Wendy Poulson, who is the founder and creator of My Body Passport. She is a PhD, is a lifelong health and wellness enthusiast and consultant in chemical engineering to environmental, energy, and educational sectors. Wendy specializes in simplifying and solving complex questions and problems. A combination of the issues experienced in a visit to the emergency room, advocating for aging relatives, and a desire to manage her own health led Wendy to develop My Body Passport to provide a simple and reliable way to keep track of and easily access our health details. My second guest, she's been a frequent flyer in my LinkedIn Live. I so appreciate her. And my friend, Janet M. Taylor. She is the president of Totally Organized LLC, is a life organizer. And can I tell you, she is a life organizer. Speaker and host of the Got Clutter, Get Organized podcast with nearly 30 years of experience. Janet helps clients transform cluttered spaces into functional, peaceful environments. We all could use that. She has appeared on HGTV's Mission Organization and The Rachel Ray Show and has shared her expertise with audiences across the country through workshops, webinars, and media appearances. I asked Janet because she also utilizes this tool, and I think that it would be great to see a patient perspective. And so I really wanted to hear, what and how Wendy's tool has helped her navigate in the world of, I'd say, there's still digital discrepancy that is happening. There is also in certain areas and states that do not have a great infrastructure of broadband access to digital devices. There are still people in our country that do not have those access to the digital tools. And so, whether that's race, ethnicity, and where they are, particularly in a rural setting. And so those are things that, are important to remember, that we also need an alternative tool, something that is just not, digitized. And while we're all proponent and want to support that, I do think we want to be aware that there are still people in our country that are suffering, and that is not being able to have a paper tool to advocate for them, to be able to explain, going into a facility, whether you're going to an emergency department, an urgent care, an outpatient physician office, places where you need to be able to tell your healthcare provider what is happening with you and show them what your updates are, what has been happening with your life, where have you been outside from being in your home, work, and life as it happens, and journeys that have taken you to see a health provider because you were sick, or healthy, a checkup, or something happened to you that led you into that space. So welcome, ladies. I am so
Thank you
excited
so much.
Thank you.
for this conversation. So Wendy, I'm going to start with you with this tool. So you gave me a brief bio, but tell me a little bit more, of the impetus, and also just within your own, creation of this, and two, how you're utilizing it for yourself and any of your family members.
Thank you so much, Sharon. You've covered a lot in the little brief intro of how this might be used. But so first, I just want to say, what is it? There's two books. This one we call My Body Passport, and it is meant for a decade worth of information. And then this one, you showed the audience both. This one is called The Adventure, and it is the size of a regular passport. And so this is your on-the-go traveling snapshot. So throughout the conversation, Janet may refer to one or the other or both, but there's two basic tools. And this one, again, is a snapshot of what this is. So what are they, and why are they? So as I mentioned in the bio, was called to the emergency room one day. A friend of mine was in the ER. And when I got there, he had been administered morphine. And one of the admin came in with their cart and started asking us questions. And besides his name and address, birth date, I had no knowledge of his medical, nor should I. I mean, why would we talk about it unless you need to talk about it? And that's what I started realizing is there are things that we actually don't need to talk about until someone needs to know for our health outcomes. So that's where the passport came in. It's like a passport. You don't necessarily share it until you have to share it. And so that was something where I was very bothered that I couldn't give them the information that would have helped him have better health outcomes at that moment. So that was one thing. And then I started thinking about how uncomfortable I am or was every time I'd go to a new doctor and I had to try and remember all the health details that they need. And I was realizing there was a pattern of disconnect. So, really, My Body Passport is a connection tool. I was noticing the disconnect that happened in the ER. I noticed the disconnect that happened with my memory and my health records, and then with new doctors or even doctors sharing with each other. And then you mentioned electronics. There is a very harsh disconnect when you can't access something that might be electronically available, but for whatever reason, and there's a myriad, that there is a disconnect. So I would purpose then, and I started out by just collecting intake forms, and I just merged all these intake forms. And then I'm very fortunate that my sister is a medical doctor. So she is a practicing MD. So I didn't have to become a medical expert. I had access to one. And so she was my medical expert to get all the medical aspects of this right. So took a while, but I was able to put it all together and got some help from other people to make it checkbox friendly, like a lot of reviews to make sure it was user friendly, that we weren't writing things down all the time. So a lot of checkboxes organized in a way for a first responder to see it first, to see the front part, and then more your what things that you just want to remember on the back end. But generally, the reason I created it was to connect and to bridge a gap between whoever the health first responder, healthcare person, physician, whoever they are, and the health history of my entire body. So
That's awesome. Now, Janet, how did you and Wendy meet? And then after meeting her, like, what does my body passport mean for you as a patient? Like, how has that helped you with your provider visits? How did the providers receive the patient tool when you presented to them? Like any interaction that you might have, and then overall, what did happen in that journey, and then kind of what have you gotten as far as feedback and whatnot?
Well, Sharon, I don't remember the details of how we met. I know we met over the internet. I do know that. I still remember our first meeting. We met face to face. She bought me the product. And of course, here is the one that's on my refrigerator. And then this is the one I actually travel with.
Okay.
So I really, once I saw the product, I saw how it organized everything, but I also saw how it could empower me when I go to the doctor. Because, every time you go specifically for those annuals, they ask you, when was the last time you did this? When was this? When was that? And then you're trying to figure out when it was, the date. And this particular really helps me to be able to just kind of go through and just give them specific dates. Um, if there's asking details like, did you have a procedure? When was it? Um, and also for me, in the empowerment part, it actually lets me see areas I may need to work on, because then I have an area where I can put my test results and then I can compare. Like, okay, this is my blood test last year. These are the blood tests this year. Okay, I see improvements here, but then these are areas where I need to improve. And then it also allows me to really have a conversation with my doctor. Because one of the things I do now is when I know it's that time for my annuals, I always
Mm-hmm.
ask the doctor, can I take my blood tests and all that stuff before we actually meet? So then when I meet, we can really have a face to face conversation about what's going to work and what isn't going to work for me. So that's why I really like it. But also, I like it because as someone who's single with no children, at least I know that my best friend and my godchildren, should they need to know something in the event I'm not able to communicate it, I have this on my refrigerator, and that's, and this is a wonderful symbol. But then also, if I'm out with clients or even just out with friends, there's certain things that they need to know, like what are my allergies? Or if somebody says, well, did she have this, that, and the other? Then this information is right here. They don't have to try to, figure it out. So that's why I love it. It's really about being organized, but empowering myself as well. I mean, because I've got portals, like a lot of people, but still,
Mm-hmm.
when you're in front of the doctor and that gown on the table, you're not trying to pull up you just need to be able to have stuff in front of you. So that's why I use it.
So there were several nuggets that you dropped in there that I like, and Wendy, let me know if there's anything that I might not be saying correctly or something that you want to add. So one thing I did like is you have both. So you have this at home in your refrigerator, which I
Hmm.
like.
Hmm.
But this means this can be like a basis, right? Like you can leave this at home because this is something that you're gonna update once you get all your stuff from your visits, and then this could be like your main one. And the travel piece of these things, this I like also because just like you said, your friends might know you, especially your longtime friends, they know what's going on with you. They could probably, spout out some things. But like if you have someone with you that you're an acquaintance, you don't know anything, you can just pull this out if somebody asks you if you had an allergy. The thing that I wanted to ask you about is when you do the doctor's office. So in the annual visits, it's interesting you say that because you do get a litany of questions. When was the last time, did you have any surgical procedures? Did you have, did you have medication? Did you get an x-ray? Did you something, things like that. And so how is that interaction when you're in the room and you have the medical assistant in front of you and you're pulling this handy dandy, I call handy dandy tool now,
Hmm. Hmm.
much like Blue's Clues, a handy dandy notebook. So
Hmm.
this would be your handy dandy tool. So what is that interaction like? Like, how does it go when you say, okay, let me pull this out. Here's what's happening.
It's a lot. Well, the communication is a lot better. The relationship, I think, is a lot better because I come in there a lot more informed.
Mm,
But also it's a lot faster because I'm not trying to figure out, wait a minute, okay, I know I did it. I think it was August of such and such a year. And I think, but no, I'm able to put dates. I'm able to put procedures. Sometimes, depending on what the question is or what it is, I'm able to say, well, on this date, this is what the test results were. And of course, if they want to, like, well, you know what, I would really like to talk to that doctor, then of course there's an area in the back where I can, like, well, this is the doctor, this is the number, etc. So it makes it a lot more efficient. And
mm-hmm.
because I mean, nobody really wants to be in a doctor's office, number one, but then you want to, get in and get out. And again, it just, I really, really, truly, because I mean, everything is covered here. And also for me, it really makes me feel good, one, to at least see that I'm consistent, with all of
Mm-hmm.
the things that I'm supposed to do. And also, I remember one time when I had to have, an exam, and then the doctor was like, well, why didn't we do that? Because you should have had that. And I says, well, you remember that was around 2020. So things were not done during that year. And I
Mm-hmm.
said, so, then we decided to just kind of, she's like, oh, yeah, that's right. We did decide to put it off. Or for me, a lot of times it's the shots. I have to get tetanus shots. So I need to keep on top of when I take those shots because, those are not the most comfortable shots, inoculations. So that's how it really helps me as well. But yes, and I even have things, I mean, I'll just tell Wendy, I even have some things highlighted here, specifically when I have to remember, for example, when I need to take something like every 5 years, I make sure I highlight, put the year that I'm supposed to do it. So then when I look in here, I'm like, okay, next year I need to make an appointment to have this particular exam. So yes.
So Wendy, is that how you? I mean, that's kind of how I pictured it with this tool. Like,
Yeah,
is that
well,
how you envisioned it in the doctor visit in the way of like? So we're using annual. as an example, because just like a car, you want to get to that annual mechanic, to see the car, get the maintenance, right? And we're all good about that. We want to make sure the oil's changed, the tires rotated, and all the things. But like, that's kind of how I thought that tool was also going to be working for the patient.
Yeah, it was interesting for me because as I developed it, I hadn't used it. And so I became the first user the day the first one came off the printer. And people ask, well, where do I start? I'm like, start with your first visit because I happen to be going to a chiropractor that week. So this larger one comes off the fridge and comes with me to every appointment. And the beauty of it is then I fill it out while I'm there. And then when I get home, I don't have one more thing to do. I just put it back on the fridge and I know where everything is. So this larger one comes to the doctor. I write down just like what Janet was saying, what's next? What are we doing? Or I use it to refer. And what's one other thing besides saying annual, as we age, most of us end up with specialists. And so you might have a specialist that doesn't necessarily have the same electronic base as your main physician. And so again, this acts as a connector because I can, from my specialist, I can say, so what is that technical term? What does it mean? And then when I go to my general, I can say, this is what my specialist said, and this is what I understood it to mean. And so, as Janet said, I'm really a much more prepared patient. I'm not just talking to my specialist and saying, or my general and saying, I don't know, they're a specialist in blah, 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 and maybe talk to them. I can be that connector. And it also works if you are a caregiver for a relative or as a vocation, you then have access to, well, what did their eye doctor say? Well, have they been to the dentist? Do they have a foot doctor? Like, who knows, unless you keep track of things. And so the peace of mind that comes from being able to advocate for yourself or your loved one, or just know, like Janet said, it keeps you accountable and you feel good because you are keeping track of this, and it's really important.
So I like the connector, that word connector, because sometimes, and you're right, we see specialists over time. And sometimes that communication between our, general practitioner to specialists, and if you're seeing multiple specialists, some of that communication can also get, faded out sometimes, or sometimes it doesn't happen. And so the book in itself, I like that you as a patient, as a connector. But I also, the second thing that was a good nugget that I took away with is that as a prepared patient, that is a welcome for practices too, because they're very busy, and having the answers right there at the fingertips is very helpful. And yes, to your point, an annual visit intended to be at a 45 minutes or so, or depending on the practice and how they're building their schedule, being prepared also helps to being able to ask the question, and also lending itself to what do I need to keep my eye on focus? Like if you just had a colonoscopy and things went well, then you might, highlight that, oh, I won't need that till 5-10 years, but like, oh, you might have a family history of, say, breast cancer. You really need to have a mammogram every year. So you're going to highlight that, right? Because that's a mammogram that you need to do every year. If you're still a smoker and you haven't stopped smoking, then you would probably need, some kind of CAT scan just to if you fall in that category and you happen to be that. And so things that are like preventative measures, that you can highlight those. So I like being able to do that. I think the thing that I want to emphasize, that it's a benefit seemingly on both ends. It's not just you, the patient, but also, your doctor, who you're seeing, and what information you bring with. Because I think the challenge sometimes is patients may not necessarily know. And especially when you start, as we growing aging and as we starting to see more doctors sometimes, or more doctors visits, it's important to have someone to go with you, to have the stuff to be your scribe, to help some of the things, and also keep it in one spot, because if that family member is not available, you have that tool that somebody else can come pick it up and know what's happening and not be in the dark. And I think sometimes, when you have multiple caregivers, and not just one main one, it's important to have this tool. So Wendy, I think that's how I see that as well for caregivers, because caregiving I've learned in real life, it's a very different dynamic between family dynamics. And you have, one power of attorney healthcare, you have one that's your power of attorney, and then if you have two people, then two people need to know, like they need to be connected into your care. I think this is a powerful tool in the way that your family gets connected as to how they need to have this at the main table, and be like, well, what's, mom or dad, what's happening with them? And then, whoever's going to take them to the appointment, they can take that with them and update that for them. I wish I had this with my mom, but it's one of these things where it's important to jot it down. And she jot down a lot of things. She was a former teacher, and she really did jot down a few things in her doctor's visits. But these are things that I think would have merited in the way that I have a place where I know what is happening, because it wasn't always my husband, it wasn't always my sister-in-law, it was also some of our kids to help us bring. It's that piece of information to say, oh, this is what's happening with our parents. So is that what you see, Wendy, kind of in the dynamic of caregiving, that they're able to utilize this tool as a way for them to, whoever's at that time dubbed to be the person to take the doctor's appointment, or happen to be the one in the emergency, they can grab this tool and off we go.
Yeah. And, Janet and I have talked a lot about how if there is a stressful event, you're not going to remember. Like, it's hard to remember your own phone number in a stressful event, but much less, what is that drug? How often do they take it? Are they being compliant? Like, whatever, if you even knew they were on that drug. And so I think there's that part of it where you don't have to rely on your memory, under duress, under having to make quick decisions, which can happen. And then another part that was a delightful surprise was as I was filling out this with my father for him, I was able to sit with him on the sofa, and we were able to share a book, and it felt so human, I'll say, to be right next to each other. And for the family history, for example, I just went down the list, and I said, Dad, just tell me if you've had this or not. And I just went down the list, and it was either a check or nothing. And it was very easy because the list was provided. And I knew once this was recorded, we're good, because then all my brothers and sisters, all of our children, we have that single grandfather or father, like his health history, his family history. It's recorded. And it was not something where it was kind of distant or separate, but because we could be together, like across a kitchen table or next to each other, and we could just kind of go through it. And then when he would say, yeah, I have that, and I would say, oh, what happened then? And so it was a way to kind of just really get to know each other in a way that we wouldn't have. So that was really nice.
So I'm hearing it's also a legacy tool, right? So on top of it being a health tool, it's also a legacy tool. So Janet, like with you, though you may not have kids, but your other family members can know that, that Janet has this medical history from, they could probably glean as to like, well, I wonder if I had, some connection that way. Because it does get lost, particularly when, you don't know, and especially if you have absentee parents, right? And you're trying to garner and collect as much as you can in terms of what people know about their medical history. So actually a delightful surprise. I truly, because it's not just a medical tool, but it's also a family tool that this can get passed on to generation after generation, to say, oh, great grandma had, oh, we have a history of, and I'm just referring back to breast cancer, but it could be other things, colorectal cancer, it could be, um, uh, um, pancreatic cancer, things that you won't necessarily, or diabetes, or asthma, or allergies, or things like that, and your grandchildren are able to glean on that information. So that is a very delightful surprise, Wendy. I think that you've put families also together in the way that this isn't just seen one way. There's the flip side to that they can actually hold on to this and keep it, beyond, after parents pass away or grandparents pass away, that they can glean on this as grandchildren and great grandchildren, that, oh, that's the medical history. I may or may not have it, but it's something to explore, right? That
Mhm.
I can know, do I have it? And if I do, then I know, oh, that's where it came from. This is what, grandpa, grandma, had, and I can say, and it might be passed down from the parents. So that is very nice. I like that, secondary use. So it's not just one way, but it's also a secondary way to leave a legacy for your family. So just to wrap us up, though, Janet, as a patient, how do you, would you endorse this to, you and the way that, how this has helped you tremendously? Again, recognizing that I do think we have a hybrid world, that there are some folks that really could benefit in this. There's still nothing wrong with pen and paper, to be honest. For me, I think there's still benefit for that, even though we're trying to eradicate paper.
Hmm.
But I do think that there's definitely this tool that can, help us, knowing that there's two sides of this. This is even more important than I think I've even explored with you guys, just talking about it.
Oh, definitely, because I have actually referred it to clients. But also, there was a time when my doctor, she had a conversation with me about my weight, believe it or not. And I was like, I couldn't believe this because I'm a small frame person. But
Mm-hmm.
she said, if your weight continues to increase, you're going to start having issues.
Mm.
And I still was like, left the doctor's office not believing it. But then when I started looking at the numbers, because I looked down at the book and I started seeing, wait a minute, my weight is increasing. And
Mm-hmm.
so therefore, it was almost like a warning sign, because years prior, I did have high blood pressure because that ran with both parents. So therefore, I was like,
Mm-hmm.
okay, all right, Janet, the doctor gave you a warning. So now can you do in order to change that? And that's what this stood for me. It impacted me. But like you, Sharon, I wish I had this when I took care of my mother, because that would have alleviated a lot of different what ifs. I would have known a little bit more about her health history. I only really kind
Mm-hmm.
of knew what the conversations with the doctors, but then even in situations like that, it was emotional, because here's my mother. I know she's not well. I'm trying to
Mm-hmm.
listen to see what they're talking about, trying to take notes, and just trying to deal with the whole caregiving and the managing her life and trying to manage my life. So yes, I definitely would endorse this.
So Wendy, just to, how can people get in touch with you? They want to reach out to you in getting this tool, and how can we, Janet and I mean, I see the value in this completely. I mean, it's a no brainer for me. But some folks, there are some convincing to be had. But I do think that for the folks that are still in the pen and paper, I think that they would value this a whole lot. I do think that there's going to be, and I could be the low believer in all of this as far as percentage wise for the digital hardcore. But computers do have issues from time to time. We might need something that we need to bring with us as a, any downtime procedures that are considered that we need to bring paper back up, right? So how can we reach you? How can anybody, caregivers interested, what can we do to empower our patients, to be able to make their engaged in their engagement in health facilities and with their healthcare providers, and get something out of each visit as they possibly can.
Yeah, so for more information, I welcome and invite people to visit the website. So that's www.mybodypassport.com. And you can reach me through the contact page there. So I will respond right away through that. And then also you could reach me on Instagram. You can DM me. It's at My Body Passport. So those are the best ways. You can purchase it through Amazon or through me on the website. So those are the best ways to purchase it.
Perfect. So I will put that in the comments in LinkedIn. I will make sure I will get your Instagram information, get all that uploaded so that if anyone needs to reach you, they can go ahead and do that.
Yeah,
Well, thank
great.
you, ladies. I so appreciate it. I've learned something new. I always appreciate learning something new, and appreciate all of you. And Janet, thank you for allowing us to hear your side as a patient. And Wendy, thank you for creating this through your experience, and that all of us can benefit. Even beyond.
Thank you very much. It was lovely to be here.